we've been having is, let me just get this set up real quick. 1 second, sorry. Cool. Okay, let's go back to Zoom. Done here. Okay, so what we've been having, unfortunately, is a lot of disrespect, a lot of profanity, a lot of just disgusting stuff. People are sneaking into our Zoom. So moving forward, everything is going to be done on YouTube. So we're going to stream everything live on YouTube moving forward. So that way we're not missing out on stuff. But the cool thing is that we're going to do stuff randomly. And we're going to leave it, we're going to do it live on YouTube. Meaning one day we might just do pharmacology. One day we might do just maternity. And we don't know what day. Wednesdays will still be there, but everything is now going to be moved to YouTube. So if you're not following us on YouTube and you don't have your notifications on, make sure you do, because everything will be done on YouTube. There's not going to be a Zoom link sent out anymore. And it's going to be just done on YouTube. That's the only place it's going to be done. So make sure you're following us on YouTube. Make sure, because we're not going to be doing it just on Wednesdays. Are going to be there no matter what. Okay. We're going to continue with our Wednesdays, but we're going to pop up and do some random stuff throughout the day. And just make sure you have your notification on, because wherever you are, you can just press listen and you can listen to us wherever you are. So today I wanted to kind of switch it up a little bit. What I wanted to do was show you that basic care and comfort. I know we're supposed to do part 3 that Nurse Brittany had started, but what I want to do, because I'm here now, is I want to show you different things, because basic care and comfort, those of you that have talked to me about your CPR report, right? You know, the first thing I ask you is, how did you score on basic care and comfort? That's like the first thing I ask you. And what I want to show you is that basic care and comfort is literally everywhere. That's why it's so heavily weighted on your CPR. And I'm going to show you that not only in your regular, what you've already learned, like wound care and things of that nature, that we actually are using basic care and comfort everywhere. You can't tell me a topic where we don't use basic care and comfort. Tell me in cardio we don't use it. Of course we do. MI, heart failure, management. That's all basic care and comfort. Education, maternity, endocrine. Anywhere you could think of, we use it. So what we're going to do is, I want to really focus on a couple of things. This is going to be my way of showing you basic care and comfort combined with pharm, because I know everyone hates pharm. So we're going to use the method, and we're going to, let's see. I actually kind of want to see, Melissa, can we enable the chat? I want to see if we get a little participation. If anybody disrespects it, we'll just cancel it. Enabled. Awesome. Can somebody say hi to me? Hi, perfect. All right. So we've got people. If we see any disrespect, we'll remove people. But I do want people to participate. That's my biggest thing. So because I'm back. I haven't been here for a while, so I'm back. But again, I want you to see how even in medications, in pharm, basic care and comfort, education, things of that nature, it's there, right? So let's get started. I'm so glad to be back in front of y'all. Super excited. I made a little what's it called? I made a little IG reel today about Beck's triad and cardiac tamponade under 60 seconds. Make sure you check that out. So I missed y'all too. I hope to. That's why I said make sure you're following us on YouTube. On YouTube, make sure you are, because we're gonna disable Zoom because of what's been happening. And if it happens again today, we'll just disable the chat. But I want everyone to participate. So, all right. So we're gonna use the method because I don't think we get to practice the method a lot. And those of you that watch all the interviews of all the students that come by, the method is arguably one of the things that keeps you most organized in your thought process, and it helps you. It's good to be back. So we're going to start with the end. It is a select all that apply question, but which of the following statements made by the client indicates understanding of the medication? So what exactly are we looking for? We're looking for answers that are right, statements that are correct, right? So a nurse is providing education to a client who has been prescribed furosemide, Lasix. Somebody tell me what type of a drug, what drug allergy is related to furosemide? We talk about this in the course. Good. Sulfa. So we must educate our patients that this is in fact a sulfa drug. It's a loop diuretic. So when do we typically use this? I'll take two answers. When do we use furosemide? Heart failure, good job. I'll take one more. Fluid overload, heart failure, I'll take that. Yep. High potassium. Okay. Oh yeah, I'll take. They're all great answers. I love it. It means we're understanding. Fluid overload, yeah, great job. So we start from the bottom. And we say, is this a correct answer? I should expect some weight gain as a normal side effect. Does that sound correct? Good. So we're going to eliminate that. I need to report any ringing in my ears to my healthcare provider. Why? What's the mnemonic that I'm looking for here? Oh, dang. Ototoxicity. Yeah. But do you see how this is basic care and comfort? If I'm giving a drug, don't I have to take care of them on a basic level, make sure they're comfortable, make sure they're not having ringing of the ears, fullness, balance issues? Do you see how even with farm, there is education which translates to basic care and comfort? Are we starting to see how all this is all related? So yeah, absolutely, I would agree. I should take this medication in the evening to avoid waking up at night. No, absolutely not. Right? Why? I mean, unless you're really upset with your patient, then you tell them to take it at nighttime just to mess with them. But otherwise, you get, if you like them, tell them take it in the morning. If you don't like them, tell them take it at night. But yeah, we're definitely not taking this in the evening. I may need to take potassium supplements. That's basic care? I've got to care for this patient's electrolytes. That's basic care. So we're going to give them potassium supplements. I should avoid foods in high in potassium. Okay. We're saying I'm going with the majority, and we're saying no. I need to monitor my blood pressure regularly. Why? What's the first O that I talk about? Orthostatic hypotension. Good. All right, let's see how we did. Excellent job. So the point here is one, we're learning farm. Two, we're learning that there's a lot of basic care when it comes to administering medication. So they go hand in hand. Anywhere when you see, like in this situation, we're talking about heart failure. What are some basic care and comfort that we're going to do in heart failure? This is just dealing with their medication. But what about just in heart failure in general? What is some basic care and comfort that we would do just in heart failure? Let's just talk about it. Let's have an open discussion. Bed rest, but where? Are we going to elevate the head of the bed? Upright position. Good, right? We want to elevate the head of the bed 35 to 45 degrees. What is that called? Semi-fowlers. Good. So again, positions. So you see, I just started with one thing. I'm talking about furosemide. We're doing a little bit of farm. We went into basic care and comfort. And then we went from there straight into heart failure, knowing that we use this for heart failure. We talked about that fluid overload, heart failure. And now we're talking about basic care and comfort. So what about blankets if they're cold? Isn't that basic care and comfort? Absolutely. If we're looking, how about oxygen? Isn't that basic care and comfort? So again, it comes in various forms. So when we learn basic care and comfort, don't limit it. Fluid and salt management, weights, that's basic care and comfort. Yeah, that's basic care. Hello. Yeah. Comfort is elevating the position, giving them oxygen, right? So very important to understand that basic care and comfort is everywhere. That's why when I read your CPR reports, and I apologize if I haven't gotten to all of them yet, or if Nurse Brittany hasn't, we're working our way through them because we've gotten um, an, a bunch of them. Melissa, can we put in the chat the link to fill out the form to call and to fill out for CPR reports? Yeah, and then again, yeah, exactly. Clear communication. They're found at the bottom. There you go. Thank you. Um, again, it's everywhere. That's why the first thing I ask you is what was your result on basic care and comfort. So excellent job here. Any questions so far? Good. Oh, why is it not clearing? There we go. All right. So let's continue on with the same topic. Because again, one, we're doing farm. Two, we're incorporating basic care and comfort. Three, we're dealing with heart failure. So there's a lot going on right now. So we start with the method. Which of the following should be included in the teaching? It is a select all that apply. So a nurse is providing education again, who has been prescribed a thiazide diuretic. Now, I'm going to say this much. We did furosemide. We did a loop diuretic. Now we're doing a thiazide diuretic. What's the third diuretic that I teach? Potassium sparing. So between those three, do you think I could create a matrix or a grid comparing all three in a heart failure case study? Yes, absolutely. So very important to understand that just because we're doing these as individuals doesn't necessarily mean that I can't convert this into a matrix or grid. So we start from the bottom. Avoid prolonged exposure to sunlight. Why? I don't want just a yes. I want the why. Sat for a photo. But what part of sat for a photo is this? It's a sulfa drug. Good. Thiazides are also sulfa. Monitor your weight regularly and report any significant changes. Okay. Take this medication at bedtime to avoid dizziness. Again, same concept. It's a diuretic. You may experience muscle cramps as a side effect. Now, in this situation, if they have muscle cramps, what are we worried about? Which means it's going to lead to what? It could lead to ventricular fibrillation, right? That's what we're scared about. Asgraph. So again, we have to educate. Increase your intake of potassium-rich foods. Okay. So again, we're dealing with heart failure here. We're educating them. Any indication of muscle cramps, we have to be very cognizant of. So let's see how we did. Excellent job. Do you think that these drugs that we've talked about are high yield? Super high yield. Anybody that's ever taken the exam before will know that these drugs show up. They really do. There you go. All right. And the last one. Which of the following should the nurse include in the patient's education? Again, we start with the end, using the method. Select all that apply, and a 58-year-old with heart failure prescribes spironolactone. So what type of diuretic is this? It's the third type that I teach. Potassium sparing. Good. So ultimately, again, this is a matrix or a grid. I just made them all separate so we could talk about them individually and incorporate that basic care and comfort into this. Report any unusual bleeding or bruising to your healthcare provider. Okay. Why so? I'm going to go with everybody. I do want to why though. We'll go through it. It is safe to use salt substitutes while taking this medication. Why no? What are salt substitutes typically? Salt substitutes are typically high potassium. Okay. You do not need to worry about kidney function tests while on this medication. No? Okay. Monitor for signs of hyperkalemia, such as muscle weakness and irregular heartbeat. Okay. Take the medication in the morning to prevent nocturia. Good. And you should avoid foods and high in potassium, such as banana and oranges. Yes, again. All right. So the one that I didn't get an answer from is 6. But why? Potassium sparing. Yeah, that's, I mean, ultimately, I mean, if you have any unusual bleeding or bruising, even if you didn't know this answer, even if you didn't know this about spironolactone, doesn't that just sound like the right thing to do? Like, this is test taking strategies, right? It's just common, it's like common sense, right? So again, we always take diuretics in the morning. But look at the words. Any, where is this at? Unusual bleeding or bruising. Unusual. Yeah. You see the word unusual? So when I teach you test taking strategies, you have to understand every single word counts. But in general, whether you know why spironolactone can cause bleeding or not, but unusual bleeding, new bleeding, acute bleeding, you see the words I'm using? These words are indicative that something is wrong. Ask graph, right? Ask graph. So yeah, absolutely. All right. So this, those of you that know, this is a board favorite. I don't know why. But what is some basic care and comfort for Kawasaki's? Give me some things that we would do for a patient with Kawasaki's disease. Because what is a mnemonic? Crash, right? Crash is a mnemonic. So we have to be very cognizant of the fact that this is in fact a child that is with a very high fever. So yeah, fever control, basic care and comfort. All right. Immunoglobulins. We'll talk about that. IVIG. Yeah. Um, we need to basic care and comfort is yeah, aspirin. But the thing about this is they have a very high fever, they have a rash. So who are we really taking care of aside from the child? Where is the basic care and comfort lie as well too? The parents. Yeah, the parents, the caregivers. And in that situation, so the one thing, um, so those of you that don't know, I was hospitalized recently, but I was in a different country. I was in Canada, and I will tell you this much: I was hands down impressed with the nurses. I was in the I was in the ER, in the ICU, and then down to med surge, and then they discharged me after a week, little over a week. And the one thing that I realized was that educating, I'm good now. Yeah, it was totally random. Um, so we when I was there, because obviously I deal with nurses here, um, all the time. I teach you all. A lot of you are, most of you are from here, but I've been hospitalized here before, but never in another country, never in Canada. And I was so impressed with their basic care and comfort. Do you want a warm blanket? Yes, I do. I'm freezing. You know, um, would you like some water? Would you, ice water? Yes, please. Do you want some juice? Do you need anything? Do you want me to raise your head of the bed? Things like that. Do you need me to, walk you to the restroom because I was hooked up to so many IVs? Um, and I was just so impressed with the basic care that that's what I try to instill upon you. And when we're dealing with pediatrics, um, we're also dealing with the caretakers. So when you're dealing with basic care and comfort, you have to also comfort them. How do you comfort caretakers? Yes. Education and communication. That's it. That's all they want. Just check on them, especially those of you that go into peds. If you go into peds, just check on them. Just walk in and say, are you okay? Do you have any questions? That's it. Imagine those two questions. That's it. It's emotional support, basic care and comfort. But again, you're dealing with the caretaker. Now we're dealing with the child. So let's talk about their treatment. So which of the following treatments is most appropriate to reduce the risk of coronary artery disease? Well, look, this is a freebie question, is it not? We're dealing with a 3-year-old with Kawasaki's disease. So it's a freebie question because what type of a question is it? It's farm. So either you know it or you don't. So we know that we're going to do aspirin, IVIG, but we're going to look at this. Antipyretics and antihistamines or IV antibiotics and fluid resuscitation. Well, between the two, I probably want to get them on IV, right? Antibiotics, maybe, over antipyretics and antihistamines. Low dose aspirin and steroids or IV antibiotics and fluid resuscitation. I'd probably go, okay, we're saying 2/3. And now we're down to 50-50, and we obviously know what the answer is. So again, taking care of this child's fever, they're probably going to be in pain. So pain management, supportive care, oxygen, whatever we need to do, basic care and comfort. And we're also dealing with the caretaker. So again, good job. I'm glad that we don't have any issues with the chat. So again, just a reminder that we do have, if you need to talk to us, I'm literally making phone calls from tomorrow through the weekend. So if I didn't get to your CPR report, if I didn't get around to you, myself and Nurse Brittany are making calls all through the weekend. So that's like our main goal, is to catch up with that. All right. So, which of the following statements made by the parents indicates a correct understanding of the medication? So one of these statements is correct. So a nurse is caring for a neonate diagnosed with a patent ductus arteriosus, or a PDA. The neonatologist has prescribed indomethacin. So what day do you think we're at if they prescribed? Give me a time at least after. Good. Nurse Chris, you're right. After 72 hours. Nurse Grace, you're right. Yeah, after 72 hours, right? Because between that day 1 or day 0 and day 3, it's normal. It's expected. It's expected. So, which of the following statements? Now, with a child with a PDA, when are we going to discover it? When are we going to hear it? Right when they're born. Yeah, right when they're born. Right when they're born, we're going to hear a PDA, and then we continuously monitor and monitor and monitor, because we're going to listen to them every single day until they get discharged. And if we hear it after day 3, now we're looking at indomethacin. So indomethacin is used to reduce pain caused by a PDA, or indomethacin is given to prevent infection. Any of those look good? Okay, we'll take 3/4. Okay. Indomethacin will help in expanding the ductus arteriosus to improve blood flow to the lungs, or It's given to prevent infection. Okay. Indomethacin is used to close the ductus arteriosus by inhibiting prostaglandin synthesis. 100%. Right? Now, indomethacin is what type of a drug? It is an NSAID. It is an NSAID. Which means, what are we not going to do? Because we need this open, we're not going to give any NSAIDs when? During pregnancy. Especially what trimester? More so third. Yeah, more so third. And then this will help close after day 3. Now, in this situation, there's a lot of education. A lot of basic care and comfort comes in maternity. So, basic care and comfort, let's talk. If a patient is in pain in their 3rd trimester and we're saying don't use an NSAID, what are some things that we can suggest as basic care and comfort during their 3rd trimester? Because that's when we're definitely not giving them an NSAID. So what are some things? Positioning. Okay, I'll take that. Breathing, deep breathing, good breathing techniques. What else can we use as an alternative for basic care and comfort at that point because they're in pain? What's our alternative? Acetaminophen. Good, acetaminophen. So again, there's a lot that we can do, and a lot of basic care and comfort in maternity. A lot. All right. Which of the following statements by the patient indicates a need for further teaching? Uh-oh. You know I hate these questions because they mess with my head. Because we're looking for an answer that is a statement that is incorrect or wrong. So a nurse is providing discharge teaching to a patient with coronary artery disease who has been prescribed atorvastatin. What do we know about statins? A lot. There's a lot to know. So which of the following statements is incorrect? This is where that whiteboard comes in handy. Okay. I will have my liver function test periodically tested while on this medication. Yes, as a matter of fact, when are we going to start testing the LFTs? Before administration and then periodically. Yeah. So I would definitely say this is a correct answer. So we're looking for something incorrect. I can continue to drink grapefruit juice daily as a part of my diet. So does that sound incorrect? This is incorrect. Okay. Why? This and what other drug in coronary artery disease do we not use grapefruit juice or grapefruit products? There's one more I'm looking for. There's one I'm specifically looking for. It's not warfarin. Keep thinking. Go back. What other drug? What other drug do we not use? Again, somebody said it. Calcium channel blockers, right? So you see how I made the association. Calcium channel blockers. Yeah. Okay. All right. But we're not done yet because we're still, even though we know we got an incorrect statement, we're still going to finish the question out. I will report any unexplained muscle pain or weakness to my healthcare provider. Yeah, you will. Why? What's good? Rhabdomyolysis, right? And then I should take this medication in the evening. And we talked about that as well, too, ad nauseum. So again, we found our right answer, or our wrong answer, I should say. And there we go. So as part of a coronary artery disease, let's talk about basic care and comfort. When they've developed to the extent where they're starting to get angina, or they've even gotten further than that, they've got stents. What is some basic care and comfort that we would do for a patient with coronary artery disease that received a stent? Let's just go straight to they got a stent. So what are we going to do? What's some basic care and comfort? How about stool softener? Does that sound like basic care and comfort? So they're not straining? That sounds like it to me. Yeah. Are we going to uh, have them do a little bit of physical activity, what they can tolerate? Absolutely, we are. Are we going to monitor their coagulation as a part of their basic care? Yeah. Because they're going to be on what medications as a stent gets placed. So we're going to do bleeding. They'll be on aspirin and clopidogrel. Good job. So basic care now is going to be taking care of somebody that is at bleeding risk. That's basic care. That's just, I mean, that's about as basic as it comes. You know they're anticoagulated. They're on aspirin and clopidogrel. They're not going to be able to clot. So what are some things that we're going to say? Basic care is going to be bleeding precautions. Name the bleeding precautions because that is high yield all across. Soft bristle toothbrush, night lights, no contact sports, basic care. I don't think you can get more basic than that. Bleeding precautions, right? So again, yeah, when you're post-op, keep your legs straight for 4 to 6 hours. Electric razors, no more regular razors. So again, hydration. So basic care is simple. When I talk about basic care and comfort, I want you to realize something. Basic care and comfort comes in two of my mnemonics. Needs, 100%. Give me one more. Needs, we can do outpatient. Ash is going to be prioritization, NIPA. Good job. So inpatient, NIPA, right? Basic care, NPO, IV fluids. Pain is needed, PPI is needed. Antibiotics is needed, antiemetics is needed. That is basic care and comfort. Outpatient or upon discharge, needs, basic care and comfort, nutrition, exercise, no alcohol, don't smoke, and sleep. That's it. So two of the mnemonics that I've come up with were worried about basic care and comfort. So excellent, excellent job. If y'all are understanding the stuff that I'm talking about, you're in good position. If you're not, don't worry. You'll be able to watch this stuff or get one of our tutors. A lot of this is on YouTube or on podcast. It's on YouTube and podcast. You can find it on there. So again, very important that we understand that there's literally basic care and comfort everywhere. And so not only are we getting farm done here, we're taking it to the next level. And I want you to understand that I'm doing kind of a 2-for-1 now. I'm trying to show you that because everyone bugs me about farm, which by the way, the entire farm course is written. I wrote the whole thing. It's just not done in the notes yet. So it's like in my little like notes app, but it's done. The whole thing is done. And I'm talking stuff that I've never talked about before. Let's see here real quick. I'm just going to mention this stuff because you're going to be like, well, first of all, it's going to be a 3-hour course. So obviously we got cardio, which is a given. That's what we're going to start with. We're going to do endocrine, different types of insulin, thyroid medications, cortisone. We're going to do GI. Obviously, that's a given. Maternity, oxytocin, terbutaline, things like that I haven't talked about. Respiratory, you already know. Musculoskeletal, bisphosphonates, methotrexate, things of that nature. Neuro, we're going to do that. Hematology and oncology, EPO, doxorubicin, cyclophosphamide. Like these are things that I've never talked about. It's a 3-hour course that I put together on farm. So it's going to be strictly farm. So it's 3 hours long. So keep an eye out for that. It's going to be soon. It's going to come out real soon. Last day for the 3-day course. Melissa can answer that. I don't know because it fills up pretty quick because we cap it. So, all right. Which of the following? The book is being made as we speak for farm. So, which of the following instructions should the nurse include when teaching the patient about this medication? So, what medication are we talking about? We're talking about sublingual nitroglycerin for the treatment of angina. So, when we're dealing with angina, what is angina first and foremost? What's another word for angina? Not heart attack, chest pain. Good, chest pain. We didn't quite make it to an MI or heart attack. So, chew the tablet before swallowing, or place the tablet under your tongue until it dissolves. 3/4. Swallow the tablet whole, or place it under your tongue. Well, it's sublingual. Take the medication with a glass of water, or let the tablet dissolve under the tongue. Yeah. Now, when we're dealing with nitroglycerin, we must understand we must understand the side effects because that's where the basic care and comfort comes. The basic care that you're going to deal with angina is the fact that this patient is dealing with chest pain. So when we're giving them nitroglycerin, sublingual nitroglycerin, what is some basic care that we're going to teach them? Good. After the first dose, if the pain persists, call 911, right? So no longer do we use Mona Bash. That's actually for myocardial infarction. It is now, the mnemonic is thrombins 2. Thrombins 2. So we do have a quick tip. It's pretty much everywhere. So it's in our quick tip book as well too. Yeah. So Monobash is what we used to use, but now we use it. We use it 3 times every 5 minutes. Excellent job. We're worried about orthostatic hypertension. Sorry, 1 second. Okay. Sorry, I didn't see that. I will do that. Sorry, 1 second. Let me make Nurse Brittany's going to be here to do trivia with you all. So let me make Nurse Brittany a co-host. All right, Nurse Brittany's in the house. Okay, so the thing about this again is we're really worried about the storage of it. So you're going to educate them that, hey, this is in fact something that you cannot take out of the dark bottle. It must be stored in a cool, dry place. Okay. But basic care and comfort when it comes to that chest pain is the basic care is educate them to take that sublingual nitroglycerin. And if it does not work in the first dose, then you're calling 911. And then as we get to the ER, what is some basic care and comfort we're going to do for somebody with chest pain? Well, we start with NIPA. Can we do that? Oxygen, for sure. NPO, IV fluids, pain is needed, right? PPI as needed, antibiotics probably not there, but antiemetic if they're nauseous. Oxygen for sure, right? So this is your basic care and comfort. What way are the boards going to ask basic care and comfort? Checking vitals, good. It's going to be a select all that apply. Yeah, it's going to be a select all that apply. It's going to be in a case study, right? It's going to be potentially a bow tie. Let's make a question off the top of my head, a bow tie question. So if the diagnosis is angina, unresolved, right? It could be prioritization. Look at how many different ways I could ask this question, right? But let's just talk about the basic care and comfort. So if we talk about basic care and comfort with angina, it didn't work. They came into the ER. We diagnosed them with, angina, stable, unstable, whatever it is. So what are we going to do? What are the actions? Let's go to the left side. Like I'm visualizing this. I'm making this up off the top of my head. Okay. So what are some actions that we're going to do? And I'll take multiple things. EKG, I'll take that. Vitals, I'll take that. Oxygen, we'll take that. What are some parameters to monitor? Let's go to the right side now. What are we going to monitor? Troponins, I like that. Cardiac enzymes. Their O2 levels, right? Cardiopulmonary assessment. So you see, I just made a bow tie off the top of my head. But when you start to think like that, when you start to think like me, guess what? You're passing this exam. Okay. So when you start to think heart rate, blood pressure, like all these are great answers. And these are all plausible options. So when you start to think like that, it takes it to another level. And that's what I want you to take away. now that I'm back, and like I said, y'all better be following us on YouTube and put your notifications on because you don't know when I'm going to pop up and do something random. I might do a little 20-minute segment. I might do a Q&A. I might do, I don't know. I might surprise you with something. Okay. But just make sure that you're following because I might do something just totally random. Okay. And it may be middle of the day, it may be in the evening. Who knows? Myself and there's Brittany are we're trying to shake things up a little bit over here. So if you want to join the next live class, you can email contact@nclex.yield, or you can go ahead and just register online. So I appreciate all the compliments. I'm gonna wrap it up here so that way we can get a little break so we can switch over from me and there's Brittany. With that said, one, I'm grateful to be back. I'm thankful to be here and y'all to be here in front of me as well too. Join that YouTube because like I said, I'm back and I'm gonna surprise y'all with some stuff. I'm excited. I'm excited. So let's make this happen. And with that said, I appreciate everybody here. I'm glad that the chat didn't do anything um, nasty. So I missed y'all too. I missed y'all too. So with that said, I want everyone to enjoy trivia and enjoy. And there's Brittany. What time do you want to start?
We usually get started like 7:10 Eastern.
Okay, so
let's stick with that.
let's stick with that. Let's go 15 minutes. So that way you can go get a bite to eat, use the restroom, so on and so forth. And thank you all so much. I know trivia is also a lot of fun. There's Brittany. Thank you for taking over. I'm gonna make you host.
Of course.
And let me get out of here. Okay, cool. All right. I will see y'all later. Make sure you join.
Bye, Dr. Z.
Because I may bye. Like I said, me and this Brittany are gonna surprise y'all on any platform. It might be Instagram, might be YouTube. Just make sure you're following us. Cool. All right. And remember, no more Zoom. It's all gonna be YouTube. It's gonna be on YouTube. So make sure you're joining there because that's where you're gonna be able to stream and watch it. Cool. All right, Miss Brittany. Enjoy.
Thank you, Dr. Z.
Thank you.